Okay guys, so I'm going to do a reaction video today on cupping therapy. I find it fascinating because lots of celebrities, The Rock, Phelps from swimmers, there's loads of people that do cupping and seem to think it's this magic thing. Right, let's get into it.
And so she has a lot of adhesions and a lot of scar tissue built up around that low back injury. And so what we're doing today is we're doing something called cupping. Cupping is a myofascial release technique that we use here in the office, but now we're going to do some soft tissue work where we're going to help release that adhesion.
Okay, so scar tissue and adhesions. So cupping can't do anything to scar tissue, can't do anything to adhesions. We know that for myofascial, to deform myofascial tissue takes about 454 kilos of pressure, which I'm pretty sure these cups aren't going to do. So again, I think this is the thing on YouTube and in general, people will talk about cupping and they don't really understand the mechanisms, they don't really understand, what it actually does and, the benefits it's meant to have.
It's actually an ancient Egyptian and Chinese medicine that was used many years ago, actually thousands of years ago, that we are still using today.
Just because something's been used for thousands of years doesn't mean it's good. There's plenty of things that people have done for thousands and thousands of years that we don't do anymore because we know that they're wrong or we know that they're ineffective. I don't like this point of view that just because you've done it for thousands of years, that's good. It doesn't make it good. It either is good or it isn't good.
So we're going to start by applying a couple of these down here first. And we're suctioning up with this little handheld tool here to help lift and raise the tissue up into those cuffs. And we're going to let these sit here just for a little bit and let them start to lift up any of that old blood flow, any of that adhesion that's inside of there. And again, it's going to help stimulate the lymphatic system. It's going to help with stimulating the nervous system and just helping overall adhesion release in there.
Again, a lot of this language is just wishy-washy. It's like, I'm going to help the nervous system. Well, how is it going to help the nervous system? Are there any research studies to show that? No, there aren't. It's going to help adhesions. In what way? How is it going to do that? There's just fuzzy thinking around these sorts of treatments, and there's no real justification or evidence behind what they do. Ultimately, yes, if you look at the cups, biologically, it is drawing blood to the surface. But I hate this thing of, it's drawing old blood to the surface and getting, releasing old blood. It's like, well, no, the blood stays in the body. Unless you cut the person, the blood's not coming out, it's staying in there. So, yes, it is drawing blood to that area. It is drawing blood into that, so increasing circulation in that area. But you can do that with a hot bath. You can do that with a light massage. You can do that with light, gentle exercises of those muscle groups. You can do that with isometric exercises of those muscle groups. So there's plenty of other ways you can get circulation to the surface which aren't going to have the potential side effects of bruising the skin. It's not going to feel sore after having done it. I just think there's other better ways that you can get the same effects that you're going to get from cupping. Without the person just being laid there and being completely passive.
What I can see here so far is I'm actually going to remove this one. It's her biggest problem and pain is going to be right on this left side. How are we doing, Andrea?
Yeah, definitely feel that.
Pretty intense, right? Okay, so I'm going to start just to move those and glide those through there. And so I want you to come zoom right in here again. And there's some mild little red bumps that you're going to see inside that, and that's called petechia. And that is when blood vessels have actually, hang in there, Andrea, good job, have actually laid down blood vessels, the body's laid down blood vessels to the scar tissue, trying to support it. And so that's what those little red bumps are when we start to do some cupping in there, is you're going to start to see some petechia. Hang in there, keep breathing. Doing okay? Pretty intense, right? Mm-hmm. So we're going to leave these on here for a little bit longer.
I mean, to me, this girl seems nice. She's asking the patient how she's doing, how she's getting on. She's obviously caring for a patient. I think she's just been taught this by another chiro or someone else that does cupping, and they've said to her, look, it's really good, it's great, and you should get involved with this. This is what it does, and there's no questioning behind those, as I say, the biological plausibility of a lot of these things. People will turn around and say, oh, but it doesn't matter because it works. But ultimately, if there's other things that can do exactly the same thing without causing bruising and without being so passive, that gives people more locus of control, which means that they feel more in control of their pain, then that's better. So when you look at the studies for this, and I'll put the links for the studies in the description below, what you find is that there are not very many studies on cupping therapy. The study methodology and the general papers that they do are quite poor, so there's a lot of bias involved in them. But there is some evidence for some conditions like herpes zoster, so shingles. It may seem to help with, but from a pain management point of view or from a lower back pain point of view, there really isn't anything there to suggest that it's any more effective than sham. So things, again, similar to acupuncture, a lot of acupuncture trials, when they compare it to sham acupuncture, it's no better. So sham acupuncture or sham cupping being pretending to do the cupping or pretending to do the acupuncture, but you're not actually doing it. And then seeing whether people get better results with the actual treatment, and they often don't. They get no better or worse results with the treatment. Often when people think they're getting treatment, they do better. And also if they are proponents of that treatment, so if they think the treatment's going to help them, they do better. So with a lot of these things, there's a huge amount of psychological effects, there's a huge amount of placebo effects that goes on with these conditions. The studies, as you can see from the papers that I've put in the description, show that there's no real massive benefit for using these things for pain management. And often in the studies, they actually get used alongside other treatments. It's not a standalone treatment that they use, and they're very, very poorly designed studies as well. There's plenty of other things that actually can treat them in a way that they get control. You can use heat, tell them to have a warm bath, get them to do isometrics, get them to do light exercises, get them to just go for a walk. Basically active movements that gradually get their body moving, light gentle stretches, things they can control. It puts the locus of control in their hands. It makes them feel empowered to deal with their back pain, to manage their back pain. That being said, you guys, let me know what you think in the comments. I'm sure people who are proponents of cupping will let me know. And if you are a proponent of cupping and you've got studies that show its effectiveness and they're good studies, whack them in the comments. Let us know. I'm certainly by no means someone that's going to completely disregard a treatment if there's good evidence for it. Unfortunately, at the moment, there just isn't good evidence. I've had a look into it and there isn't. But if there becomes evidence out there for it, then I would certainly take a look. And the other thing is really delving into asking any proponents of cupping out there what exactly they think it does, because just saying circulation goes to the area doesn't mean that's going to affect back pain. You can't just say causation, correlation. You have to actually show that the one helps the other. Does what it does actually affect back pain? So far those studies haven't been done. I don't think they will be done because I don't think that there is the plausibility, biological plausibility there for it to have that benefit. But let me know what you think. Hopefully you've enjoyed it. A little bit of a chat on cupping today. You guys let me know if you've got any other reaction videos that you want me to do on other topics, and I will see you next time.